I'd like to follow up on what Chairman Dingell said. I think he's exactly right about the potential for savings. I just want to express the intensity of my confidence that there is a path forward through this. It's a path that requires expanding our health information technology infrastructure. It's a path that requires improving our healthcare quality delivery and the prevention investments that we make in ways that can save enormous amounts of money, and it requires payment and reimbursement and billing reform. If we do those three things, I think in addition to their immediate benefit, we also set loose virtuous cycles. This is urgently needed. Again, I'm following on Chairman Dingell, in the old days, the insurance industry stopped this with Harry and Louise. We're past the Harry and Louise moment. We're at the Thelma and Louise moment. We are in the car. We are headed for the cliff. And I think everybody gets it. The default choice is no longer do nothing. We have to do something. The problem we face, I think, is that path forward through information technology, through quality and prevention, and through payment reform is a path that is going to require both investment and management. You wouldn't expect a factory to leave a process that was creating broken machinery at vast expense with colossal waste and move to a new and efficient process that turned out a better product cheaper without investment and management of that transformation. And that, I think, is going to be our issue, particularly with those of our colleagues who think that government spending is absolutely positively and without exception a bad thing to do, and that government intervention, even to manage a transformation like this, is unalterably and in every case a bad thing to allow. I think we have to think of this as a process issue, and I think if we do, we can come to it not as a bipartisan solution, but as a truly apartisan solution, because at its heart, I believe there is a system failure problem here, and it's urgent because behind us is the suffering of so many people and so many families. I had 200 people come out to my last community dinner in Rhode Island on health care. I have a storyboard up on my website that is just exploding with stories, and each one of them is enough to break your heart and enough for action. And the fact that they're representative of a whole hidden crisis in this country, I think really should impel us to solve those investment and management problems.
We'll come back and ask you what happened to Harry, but I think Peter and then Janet had questions. Thank you.